We say all the time in public health that health is political, whether you like it or not. That doesn't mean it's partisan, but it means that our laws directly influence what we do and what we prioritize as a state and as a country, really as a world too. So if we're able to enact policy, then that's going to trickle down and really influence not only private pay insurance companies to maybe cover more services that they traditionally have not. It may make the healthy choice the easy choice in terms of, are we going to subsidize local farmers? Are we going to subsidize ag related to other than corn and soybeans, which we historically don't really, because we can do all we want in the private sector, but unless there's a policy connection, it's unfortunately not going to go very far. The main thing that stood out for me today was how well the Alliance has kind of come together, and again, with a public health background, I'm really impressed that they're really addressing the social determinants of health, because if we don't address where you live, work, and play, there's no change really going to happen in overall health. We also definitely need to focus on health inequities and health disparities, and that was a focus of this group, which really impressed me. So really, the social determinants of health are everything that influences our health, including healthcare, but healthcare is such a small piece that if we really look at neighborhoods and how can we make neighborhoods safer. Downtown Muncie right now, they're repaving all the downtown roads, and I was told by the city this is because they're trying to improve water quality and water control. That includes our health in turn. When we look at our neighborhoods, are they walkable? Do people want to be outside? Is it safe to do so? Do we have a farmer's market? Do we have a farmer's market that's affordable? Do people know what to do with that produce when they actually buy it? When we look at employment, and I think that was a big focus of today, which makes sense. We spend a lot of our time at work, but is your work site healthy? But then does your work site enable you to be healthy when you go home too? We can look at schools with kids and the school lunch program, and are we feeding our kids healthy meals? Are we making sure that those habits are modeled at home? So when we take all that together, we'll see changes in population health. But until we do, you can't just take, I love nutrition education, but I can't just take nutrition education and be like, well, I'm gonna tell you should eat more vegetables. Well, if you can't afford them, don't know how to buy them, don't know how to cook them, mom and dad don't eat them, you're not gonna eat them. So you really do have to have that more holistic view of overall health. I didn't know our state cigarette tax was so low. So today I think that was a big message coming out. But it's like, well, yeah, like why? I've lived in other states in the Midwest where it's much higher. Like why is it so low here? But another policy initiative, again, I'm a dietitian, so that's my passion is more on the physical health end of the spectrum. But really helping insurance companies finally start reimbursing for preventative health care. Moving away for that fee-for-service model will be really helpful right now. You know, you can get a bariatric surgery covered, the visits to see a registered dietitian are not covered. So I think there are a lot of those kind of things. We pay for diabetes and chronic kidney disease care, but not prevention. And if you aren't paying for prevention, then you're just gonna have more of the problem over time. So I think really trying to shift more of a prevention focus would help in all areas of public policy to help Indiana residents live healthier lives long term.